Welcome to another lecture with One Stop Nursing. Today we will discuss about anticholinergics, muscarinic antagonist. Please like, share and subscribe. Okay, let's look at the muscarinic antagonist. What does that mean? So first, before that, we need to know what the receptors mean. So a receptor is a substance that's on top of any cell or on the surface of any cell. When it gets bound to a specific chemical, it produces an effect. For example, the muscarinic receptors are present on the smooth muscles in the lungs. So when they get stimulated, what do? They get stimulated, they actually produce bronchoconstriction. So through the smooth muscle contraction. When the muscles contract, the bronchus constrict. So that's what is happening. And it also produces mucus. So is it a good thing when the patient is having asthma? Probably not. So the other thing that we know is acetylcholine is the neurotransmitter. So what do I mean by that? Now let's take a look at the picture here. So this is basically the, if you will, the anatomy of the parasympathetic system. So a ganglia is a place where all the nerve cell bodies meet together. And then the nerve before the ganglia is called the preganglionic neuron. The neuron that is after the ganglia is the postganglionic neuron. So preganglionic neuron in the parasympathetic nervous system, the one that innervates the lungs, arises from the vagus nerve. So vagus nerve is one of the cranial nerves. So from the cranial nerve, the vagus nerve, it's the preganglionic neuron comes about. And then they secrete something called the acetylcholine. We talked about this. So this is a neurotransmitter which actually gets deposited on the postganglionic neuron receptors. And those receptors are called the nicotinic receptors. Just like your muscarinic receptors, the name of the receptor that's on the postganglionic neuron is the nicotinic receptor. What did they do? So they actually get activated by these acetylcholine that is secreted by the preganglionic neuron. And when they get activated, they produce acetylcholine, which acts on the muscarinic receptors that's present on the smooth muscles of the lungs. So when they get activated, what do? They produce bronchoconstriction and increased mucus secretion. So since it is it's the acetylcholine is the neurotransmitter in the parasympathetic systems, it is also called cholinergic. All right. So remember, if we are promoting the same function of a receptor, it's called an agonist. But if we block the function of that receptor through a drug, it's called the antagonist. So what are we trying to do? So the muscarinic receptors produce bronchoconstriction. So we need to block that by giving a drug. So a drug is given, and that drug goes and sits in this muscarinic receptors, and they act like the muscarinic receptors, but instead of stimulation, they actually block the action of it. So that's why it's called anticholinergics or cholinergic antagonist. All right? Okay. So that actually explains the mechanism of action of the anticholinergics. So what is SAMA? What is LAMA? SAMA is the short-acting muscarinic antagonist. Short-acting meaning the onset of the action is within 5 minutes and the duration is about 3 to 5 hours. So that's why it's called the short-acting. And then whenever we talk about administration of SAMA, it is given after the SABA. So the way to remember is YAM comes after B, correct? So you give the B first, SABA first, and then the SAMA. So SAMA is usually predominantly used in the COPD patients, and it is not a rescue inhaler. Remember that. So what's a rescue inhaler? Rescue inhaler is SABA, but it is also used with SABA in the COPD patients during the acute asthma attack, but it is not used alone. There are some studies that working on looking at research into whether it is used alone or not, but for now, for NCLEX purpose, this is not a rescue inhaler, and the SABA, along with the SABA, it is used in COPD patients. So LAMA, what is LAMA? LAMA, the name suggests, as the name suggests, it's a long-acting muscarinic antagonist. Umeclidinium, so it's one of the drug that's a LAMA drug. This is used in asthma patients, long-term control of asthma patients, and mostly used in the COPD patients for long-term control. But this is LAMA and SAMA is usually not used together because of the side effects that they have. So if they are used together, so they actually produce more side effects. So they are mostly used by itself in asthma or COPD conditions. So the muscarinic receptors are not only present on the lungs, it is also present in the salivary glands. So what do they do when they get stimulated in the salivary glands? So it secretes saliva, but we are giving drug to block the action. So when you block the salivation, obviously the patient is going to have the dry mouth. So that's one of the adverse effects of the anticholinergics or muscarinic antagonist. All right, muscarinic receptors are not only present on the salivary glands and the lungs, it is also present on the smooth muscles of the bladder. So when they contract, what do? They promote voiding or urination. So because we are giving antagonist, muscarinic antagonist drug, it blocks the action, so it creates urinary retention. So that's one of the adverse effects of this drug. So if you pay attention here, so this is the bladder, and this is the urethra that comes out of the bladder. And then if you pay attention to this small gland right here, that's your prostate gland. So if when patients have benign prostatic hypertrophy, this gland, prostate gland, is bigger in size, and that causes the bladder neck obstruction. So if the patient has the obstruction already, then this drug is going to cause more problem, because patient is going to have urinary retention because of the blocking of the bladder muscle itself. Okay, so you have to be cautious when patients have this condition, or you would have to avoid this if the patient has severe BPH. Okay, let's look at the muscarinic receptors that's present in the lungs. So what do they do when they get stimulated? So they are present on the ciliary muscle, trabecular meshwork, and the iris itself. So when they contract, it's right here. When they contract, they produce pupillary constriction. And also it promotes the outflow of the aqueous humor, meaning the fluid in the front of the eye and the back of the eye gets reabsorbed back, and so it does not produce a lot of pressure. But when we are trying to block this function using the muscarinic antagonist, so these aqueous humor remains in the eye, and it produces increase in the pressure in the eye, and that is the name for it is the increase in the intraocular pressure. When patients have glaucoma, so they have trouble in the reabsorption of this fluid, and so when we give this drug in patients with glaucoma, it's going to make it worse, and that's why you have to exercise caution in these patients. So what are the nursing responsibilities when we give this muscarinic antagonist to this patient? So the first thing, we have to assess the respiratory system. Again, you have to assess any system before giving any drug, before and after. So you have a baseline and also knows whether the medication is working or causing any more side effects or adverse effects. So for the respiratory system, please assess the rate, pattern, breath sounds, also oxygen saturation, use of accessory muscles, and coughing and other respiratory symptoms. All right, so for this drug, you have to monitor for the side effects. So what are the adverse effects or the unintentional effects of the drug? So it's dry mouth, urinary retention, and an increase in intraocular pressure. So we have already gone over this. So when patients complain to you about dry mouth, what can you do? They can suck on the hard candy, sips of water to keep the mouth moistened. And also if the patient has urinary retention, especially patients with BPH, you would have to monitor the urinary elimination. So if there is problem with the voiding, then you would have to contact the provider regarding that. And increase in intraocular pressure, so you should know what to watch for. Monitor for headache, halos around the lights, blurred vision. Sometimes patients will also have nausea and vomiting. So those are the main nursing interventions that you would do for a patient with taking muscarinic antagonist. All right, you have to educate the patient mostly on the side effects of the medication. So again, we went over this. If the patient complains of dry mouth, educate them on sucking on hard candy, sips of water. And patient complains of urinary problems, so you would have to tell them that they have to report it to the healthcare provider. And if the patient has any kinds of symptoms such as headache, halo lights, blurred vision, nausea, and vomiting, so that may be due to increase in the intraocular pressure. So you would have to ask the patient to report it to the healthcare provider, and also schedule for the routine eye exam. All right, encourage patients to keep a log of the triggers and also the medication usage to assess the effectiveness of the drug administration. Lastly, when you administer muscarinic antagonist along with the beta-2 agonist, so which you do in COPD patients, it actually causes overstimulation of the sympathetic nervous system. So if you think about it, with SABA, we are actually doing the sympathetic stimulation. With SAMA, we are going to be blocking the parasympathetic, thereby you're allowing the sympathetic stimulation to take over. So which actually causes high heart rate and high blood pressure. It is not sometimes desirable for patients with cardiac disease. So you would have to exercise caution and monitor those patients. Thank you for watching. If you like this video, please like, share, and subscribe.